Can you see it or no?
Yes, we can.
Okay. Okay. So anyway, our discussion for today, we are almost over with the semester and we still have very few topics left. I think this is the third topic left. Okay, here's what we're going to do. I'm going to discuss, and after a few slides, I will stop and I might ask if you have some clarifications. Okay? So that you will be given time to ask questions or if you have some clarifications about the topic. Okay, so good morning, good afternoon, everyone. So this afternoon, we're going to discuss um, our topic on the urinary system. Last Monday, your topic was about bowel elimination. This time, we're going to talk about urinary elimination and why it's important and what are the relevant nursing interventions related to the topic, what are the different conditions related to the urinary eliminations, and of course, we're going to discuss what are the common conditions that are related to the urinary elimination also. And these are our learning objectives. Discuss the process of urination. What are the factors that influence urination? What are the different urinary problems? And we're going to discuss also what are the causes. And most importantly, we're going to discuss the different nursing process. Okay, now before we start our discussion on the different conditions related to the urinary system, let us first have some review of the basic parts of the urinary system. Okay, now I want someone, I think you're done already your anatomy and physiology. I want someone who can share to the class if they have some knowledge on the different functions of the different parts of the urinary system. I need a volunteer, someone who could share to us what is in the screen right now and what are the functions of these parts. Okay? Can someone volunteer? Who will volunteer? Okay, if you're not going to volunteer, I'm going to call. And I'm going to start with the boys again. Okay, Almoy, good afternoon. Can we open your audio?
Yes, doctor.
Okay, on the screen right now are the different parts of the urinary system. At least identify one and can you share to us what do you know about this part?
I think the kidneys for filtrate
Filtration of?
or blood maybe. I don't know. Doctor.
Okay, the kidneys. Thank you. Okay. The kidneys are very important because it is one of the most important part of the urinary system, and each body has two kidneys in there, and this is responsible for fluid balance and acid-base balance. And why this correct? That one of the functions of the kidney is to filtrate. Okay, filtration. That's one process. It filtrates electrolytes. It filtrates water content. Okay, before it is passed throughout of our body. What else can we hear someone from Buthaina? Buthaina, aside from kidney, are you familiar with the other parts of the urinary system? Buthaina. I will mark absent those who are not responding to my when I call you. That means you are not there. Okay? Okay. So Buthaina, Physically not there. Okay, Suha,
Yes.
are you familiar, at least name one part of the urinary system that you're familiar of?
The bladder. It's an the organ can be stretched to accommodate a large volume of urine.
Okay, very good. The bladder is an important part of the urinary system because it serves as a reservoir. Reservoir means for storage, okay, of urine. And it can accommodate as much as 600 ml. Thank you so much. Aside from the kidneys and the bladder, the ureter and urethra are also important in the urinary system. Once the urine is formed in the kidney, it is transported into the bladder through the ureter. And once the bladder reaches its full capacity and a person urge urination, there's an urge to urinate, the urethra relaxes so that the urine will pass out from the body. Okay? Specifically, the nephron is very important and it's an important part of our kidneys. And normally we have at least approximately 1 million nephrons in our kidneys. And Mr. Moaid is correct. The nephrons primarily, specifically the Bowman's capsule and the glomerulus, are very important in the filtration and the absorption of essential fluid and electrolytes. Okay? These are the basic functions of your kidneys. The detailed functions and physiology of the kidneys will be discussed in anatomy and physiology for this class. The basic functions is very important. Now, I know you are very much interested on how a urine is formed and why do we feel an urge to urinate. But before I do that, I want you to remember that the three terms have the same meaning. When you hear the word micturition, when you hear the word voiding, when you hear the word urination, they mean the same thing and they all refer to emptying of the urinary bladder. That's why when you go to the hospital and when you hear the doctor and the doctor would ask you, did the patients voided already? Or did the patients micturated already? That means the doctor is asking if the patients have already urinated. Okay, these three terms are correct. Now, I want you to look at the photo right now on the screen because it will help you understand the process of the urination. Okay, what you can see on the slide right now is the bladder at the center. Okay, and the bladder is made up of muscle, correct? And these muscles have stretch receptors. These stretch receptors can sense when the bladder's capacity is reached. When the volume of urine in the bladder reaches from 250 to 450 ml, the stretch receptors that underline the bladders are activated. Once the stretch receptors are activated, it will send a message to the spinal cord, specifically in the S2, S3, and S4. Also, it will send a message to the brain. Now, once a message is sent to the spinal cord, the micturition center will be activated again. Once the bladder reaches the capacity of 250 to 450 ml, the person will sense or will feel a sense of micturition. You will feel that you want to urinate. Okay, what will happen? The muscles in the bladder, specifically the stretch receptors, will send message through the spinal cord to the micturition center. Okay, specifically in the sacral area. Once this micturition center is activated, what will happen? Okay, what will happen is that parasympathetic and sympathetic activities are activated. So what will happen to the bladder now, to the urinary system? once the parasympathetic and sympathetic nervous systems are activated, technically the bladder will contract because of the parasympathetic activity. Aside from contracting of the bladder, you would notice that even the urethra will relax. Once the bladder contracted and the urethra relaxed because of decreased sympathetic nervous system activity, because of decreased motor nerve stimulation, that's the time the urine passes out from the body. Okay? Also, activation of these stretch receptors will activate the brain, specifically in the pons. Okay? And the pons is also responsible for micturition reflex. That's why it is very important that the brain of your patient is functioning. Why? Because not only it controls other parts of the body, but it also controls the urination of a person. That's why you would notice if a patient had a head injury, and the micturition center is affected, the patient will lose control of urination anymore. That is how important the brain is in controlling body processes. And normally, a normal adult person, okay, would urinate at around 1,500 ml of urine per day. Okay, now we're done with the process of micturition. It is very important also for us to understand and learn what are the different factors that affects voiding. What are the different factors that affect urination? The most common is the developmental factors. Technically, infant, the capacity of their bladder is lesser than the adult. And also, you would notice that babies or infants, they urinate a lot every day. In fact, they can urinate up to 20 times a day. Another important developmental factors that affects urination is that most infants doesn't have control with their urination. They will just urinate and urinate. Unlike as adults, we can control it. The moment we sense we want to urinate, we will not urinate right away anywhere. We can wait, we can run into the washroom and urinate because we have the control. But infants doesn't have much control of that unless they reaches the age of 2 to 5 years. Again, infants or children, will develop their control, urinary control, by the age of 2 to 5 years old. Okay, now, another important developmental factors is that most school children, those that ages 5 to 10, most of them normally experiences involuntary passing of the urine or enuresis. That's why if you have brothers who is 5 to 10 years old, they might, they might experience bedwetting. When they wake up in the morning, their clothes and the linen are wet. We call it as enuresis. Why? Because that is common between 5 to 10 years old, or during 5 to 10 years old, because of involuntary passing of the urine or enuresis, and that is normally common among them. And another developmental factors is that when a person gets adults, those elderlies, most of them would experience some forms of urinary problems. For example, incontinence, or urinary frequency. Every now and then they want to go to the washroom and pass urine. Or incontinence, they might have no control with their urination at all. And we're going to discuss that. Psychosocial factors is also very important as it affects urination. What are those psychosocial factors? Of course, privacy. Even if you want to void, but if you are in an open spaces, of course, no one would void in that area. That's why you can control. That's why you look for a private area. What else? Position also, especially for female. Okay, they have to be in a right position before they can void, successfully. And of course, male or boys are different because they void differently. Okay, those are psychosocial factors, and of course, sufficient time. You need to give a person enough time so that he can void or she can void successfully. Okay, how about fluid and food intake? How does it affect urination? Fluid is very important. Why? The more you increase your fluid intake, the more you will urinate. And if you have lesser fluid intake, of course, your urine output is also affected. What else? There are some foods and fluids that can actually increase urination. There are foods and fluids also that can actually reduce urination. Now, what are those foods or drinks that can actually increase urine production? If you like, coffee, humanis like coffee and tea. You also like soft drinks. Those fluids are actually increases production of urine. Why? Because they have caffeine. That's why if you drink coffee, tea, and soda, your tendency is to urinate and urinate. Okay. Now, there are also some food and fluid that can actually causes fluid retention. If you like to eat foods or fluids that are salty, high in sodium, the tendency for you is not to urinate, but to retain. Why? Because salt and sodium can cause fluid retention. That's why the urine output is very low. Okay? That is fluid and food intake. Now, how about medications? How does medications affect urination? There are some medications that can actually increases the amount of urine production. And one of the most common example of a medications that increases urine formation is diuretics. Diuretics is an example of drugs or medications, and they are given in patients with cardiac condition. And the functions of diuretics actually it can increase urine production so the patient keeps on urinating and urinating. How about muscle tone? Okay, muscle tone, it refers to the muscle that controls, the bladder and the urinary system. Okay, we call it as detrusor muscle. If the patient's muscle tone is not functioning well, okay, the tendency of the person is that the urination is also affected. Okay, how about pathologic condition? When we say pathologic condition, these are diseases. Now, what are the different diseases that can actually, affect the urination of a person? Of course, if you have a kidney problem, remember the kidney is the primary organ that is responsible for urination. If the person has a kidney problem, most likely there is a problem with the urination as well. Okay, how about surgical and diagnostic procedure? Of course, if the patient underwent surgery, okay, and the surgery involves the urinary system, the diagnostic procedures involves the urinary system. For example, the patient undergone surgery of the urinary system, or if the patient underwent diagnostic tests to visualize the bladder, these procedures can actually alter the functions of the urinary system. Now, it's very important for you to know these factors because it will help you in developing nursing interventions. Okay, now that you have identified already the different factors that affects urination, I'm going to present to you what are the common conditions or alteration in urine functions. What are the common problems related to the urinary system that you can observe among your patients when you go to the hospital? The first one is polyuria. From the word itself, poly means multiple. Poly means several times. Urea means urine. So by the word itself, polyuria means what? Production of abnormally large amounts of urine of the kidneys. Remember, as we have mentioned earlier, normally an adult person urinate at least 1,500 of urine per day. But if a patient has polyuria, their urine output could be even greater than 1,500. It might reach to 2,000 ml a day. It might be 2,500, it might be 3,000 ml a day. Abnormally large amounts of urine. We call it as polyuria. And that is common among patients who have diabetes mellitus or diabetes insipidus. I know you are already familiar with diabetes. If a patient is diabetic, you expect the patients would have polyuria. If the patient also has chronic nephritis, what is chronic nephritis? From the word itself, nephritis, nephron. The nephron of the patient, the kidneys of the patients are inflamed or there is swelling. The patients might also have large amounts of urine. Now, the opposite of polyuria, if polyuria is abnormally large amount of urine, the opposite of that is oliguria and anuria. So how does oliguria and anuria different from polyuria? Okay, you can see on the slide, oliguria refers to less than 500 ml per day or 30 ml per hour of urine for adult. Remember, the normal is 1,500. If the urine output is 500 ml a day, we call it as oliguria. Okay. There's also another term, the worst form of urine dysfunction, which is called anuria. Okay? Anuria is a condition where the urine output is very, very limited. In some cases, the patient doesn't have urine output at all. Yes, you would observe that in a patients with kidney problems when you go to the hospital. Polyuria, large amount of urine. Oliguria, less than 500 ml. Anuria, technically the patient doesn't have urine output at all. It's a minimal or no urine output at all. Okay, how about urinary frequency? Okay, what is urinary frequency? Is voiding at frequent intervals, namely more than 4 to 6 times per day. Now, ask yourself, how frequent do you go to the bathroom to urinate? Of course, it depends on your fluid intake. However, if the patients urinate 4 to 6 times per day, that is abnormal already because that's a lot, that's frequent. We call it as urinary frequency. See, 4 to 6 times per day. Okay? Some patients might even go to the washroom even more than 6 times. Maybe every 2 hours or every 3 hours, the patients would go to the washroom and urinate. We call it as urinary frequency, and that is abnormal. Why? Because urinary frequency, in most instances, are related to conditions such as urinary tract infection. What is urinary tract infection? The urinary tract, the bladder, the kidneys, there might be some microorganisms. Okay? It could be related to stress. That's why if you have exam, if you have OSCE, you cannot understand yourself, you keep on going to the washroom every 30 minutes or every 1 hour. And of course, if a patient is pregnant, also, the patient might experience urinary frequency. These are conditions that can actually cause urinary frequency. Okay, nocturia is another condition, voiding 2 or more times at night. That's why you wake up in the middle of the night just to urinate. If it is 2 or more times at night, we call it as nocturia. Urgency, this is a sudden, strong desire to void. And your tendency is to run to the washroom and urinate, or else you're going to wet your pants. Okay? Dysuria is one of the worst form of urinary problem because it refers to painful or urination. When the patients urinate, the patient might experience pain in urination. And that is actually common if the patient has infection or the patient might have some stones in the kidneys. It's very painful. We call it as dysuria. Another condition is called urinary hesitancy. What is urinary hesitancy? A delay and difficulty in initiating voiding, which is associated with dysuria. In this condition, the patient wants to urinate. There is a desire to urinate. However, because the patients might, she might experience painful urination. That's why he might be hesitant to urinate because it might be painful. There's an urge, but there is hesitation to urinate, maybe because of pain when the patients urinated. I want you to learn all the terms related to the urinary function. Okay, before I proceed, do you understand how we differentiate the terms? Polyuria, more than abnormal large amount of urine. Oliguria, less than 500 ml. Anuria, lack of urine. Urinary frequency, more than 4 to 6 times. Nocturia, more than 2 times at night. Okay. Urgency, strong desire to void. Dysuria, there is pain. Urinary hesitancy, difficulty in initiating voiding. I think it's clear. Now, there's also another condition which is very, very common in the hospital. And this condition is called urinary retention. From the word itself, retention. Remember, normally, when we urinate, the entire amount of urine in our bladder are emptied out of the body. However, there are some patients that there are some patients where they cannot, or it's difficult for them to urinate, causing what? Urinary retention. Most of the urines are retained in the bladder. Okay? What will happen if the urine is retained in the bladder? The bladder becomes distended. It will become enlarged. It will become full. In which patients we can observe urinary retention? First, if a patient has prostatic hypertrophy or enlargement. I do not know if you are familiar with the prostate gland. I want you to look at the second photo below. And I want you to look at the prostate gland. By the way, only male has prostate gland. Female, you don't have prostate gland. Now, how does prostatic hypertrophy affects the urinary system? How does it contribute to the urinary retention? Remember that the urethra is surrounded by the prostate gland, like this. If the prostate gland is enlarged, it will exert pressure to the urethra. Look at the second photo of the bladder. The prostate is enlarged. So what will happen with the passage of the urine? What will happen for the urethra? Normally, the flow of the urine will be restricted. Why? Because there's an enlarged prostate. And this is common. It comes with age. As a male person becomes older, there's a higher tendency to develop prostatic hypertrophy. Okay? That's why most of them may experience urinary retention. Surgery is also a cause. Why? Because anesthesia can actually what? Can actually affect the functions of the bladder. Okay. Remember, for you to be able to urinate, the bladder has to contract. But in cases of surgery, because of anesthesia, the contraction of the bladder is also affected. That's why the patients might have urinary retention. Aside from that, there are a lot of medications that can actually cause urinary retention. The moment these medications are taken, many patients would experience urinary retention. Why? Because these medications actually affect contractility of the bladder. Okay? What are these medications? Anticholinergics, antidepressant, antihistamines. These medications, I don't want you to memorize these medications, but you will learn these medications once you go to adults. Okay? However, I want you to realize that these medications can actually cause urinary retention. Is that right? Now, another important urinary problem is neurogenic bladder. As I mentioned earlier, the brain is very important. Why? Because the brain and the spinal cord controls urination. Correct. Now, how does neurogenic bladder occurs? Neurogenic bladder occurs if the cause of urinary problem is related to the neurologic function or the brain. For example, if the patient had head injury, accident, and the brain and the spinal cord is affected. Technically, if the brain and spinal cord is affected, okay, the system or the center of the brain that controls the urination will also be affected. So what will happen? The client does not perceive bladder fullness. The patients cannot control urination. So that means even if the bladder is full, the patients will not have the sense of urination. He will not feel that the bladder is full. He cannot control urination at all. The cause is neurologic problem, and we call it as neurogenic bladder. Okay. Now, these terms are very interesting. Why? Because I know some of you, when you were small, experienced this. I know, even me. I think one instance, I think I experienced one of these conditions. One of these is enuresis, or involuntary urination in children beyond the age of 5 years. Remember, as I mentioned earlier, urinary control is possible once the age of a person is 2 to 5. From 2 to 5, person should be able to control urination. That's why if you have small brothers or small sisters at home, before the reach of 2, they will just urinate in their pants. You need to put diapers or else they're going to urinate. They don't have control at all. However, once they reach the age of 2 to 5, that's the time we do toilet train to them. We call it as toilet training. We train them that if they feel the urge to urinate or to defecate, they need to call us and they need to go to the washroom. However, there are some children whose age is already 5 or above, but still experience involuntary urination. They still wet their pants. We call it as enuresis. Okay. Now, enuresis could either be nocturnal enuresis, or bedwetting. It affects boys more often than girls. What do we mean by bedwetting, nocturnal enuresis? When you wake up in the morning, you will feel that your pants is wet, especially among boys. Okay, we also have diurnal enuresis. This one is during daytime, even during the day. Okay, even during the day, the patient will still bedwet or wet their pants. They cannot control their urination anymore. Again, is it normal? Is it abnormal? If enuresis occurs before the age of 5, normally it is normal. Because as we have mentioned earlier, at the age of 5, urinary control should be developed. However, if the age is 5 and above, that is no longer normal. It could be a potential problem. Okay, now, ask yourself, do you still have enuresis? At your age, you should be able to control your urination. If you have small brothers and sisters at home, and their age is 5 and above, and they still do bedwetting during night or during day, it could be a possible problem. But if their age is less than 5, it's fine. Okay. Another important problem is called urinary incontinence. As we had mentioned earlier, once the bladder reaches 450 ml, the person can feel or can sense urination. But a normal adult can actually control urination. Yes, you can. Especially if you are surrounded by a lot of people and the washroom is 1 hour away or 30 minutes away from your place. Can you control your urination? Yes, we can control our urination. However, there are some patients who doesn't have control of their urination at all, causing leakage of the urine. They don't feel urination, but it keeps on wetting their pants or their diapers, and they are already adults. And this is very common among elderly people. Is it a problem? Yes. It is very embarrassing to have urinary incontinence. Imagine you are in city center doing your shopping, and then suddenly you will notice your dysdacia or your pants or your short pants is wet. It is very embarrassing. And normal urinary incontinence is caused by several factors, like if you have UTI or urinary tract infections. Okay? If these pregnant women also may have the tendency to experience urinary incontinence. Hypercalcemia, if your calcium level in the blood is abnormally high, you might experience also this. Volume overload. That means you are drinking a lot of fluid. Okay? Restricted mobility. What do we mean by restricted mobility? You know that you do not move. Maybe the patient is unconscious, the patient is paralyzed. Stool impaction, which means you cannot pass your bowel, you cannot pass your feces. And also psychological causes. If you are experiencing anxiety, if you are experiencing stress, you might experience urinary incontinence. Now, do you have any questions with regards to enuresis, bedwetting, the urinal, and urinary incontinence? Do you have a question on this line? Yes or no? Okay, very good. Now, this is very important. Again, urinary incontinence, there is an involuntary leakage of the urine. How does it occur? Because of the different causes. Now, there are different types of urinary incontinence. I want you to look at number 2. Urinary incontinence could be related to stress, and we call it as stress urinary incontinence. And normally it occurs due to increased intra-abdominal pressure. I'll give you an example. Okay. Due to increased intra-abdominal pressure. Okay. Example is that when you cough or sneeze, or and then suddenly you experience leakage of urine. The cause is intra-abdominal pressure. Okay? The second type of urinary incontinence is urge incontinence. And normally it occurs after a strong sense of urgency to void. Look at the word strong sense. I do not know if you experience this one. Suddenly, you feel the strong urge to urinate that you cannot control and you have to run to the washroom. I think in one of maybe you can experience that, especially in some instances, because normally an adult person, even if we sense, if we sense that we want to urinate, we can control it. And we can delay it for several minutes to hours, especially if there's no washroom. However, if the sense is very strong, oh, I want to urinate, your tendency is to what? You cannot control it, and you might experience incontinence. We also have this reflex urinary incontinence occur at a predictable interval. Predictable interval. Maybe experience incontinence every 6 hours. Predictable interval. Or before lunch, or before dinner. Why is it that you experience urine leakage before lunch or before dinner or every 6 hours? We call it as reflex urinary incontinence. We also have retention with overflow or overflow urinary incontinence, and this is caused by overdistension of the bladder. If you keep on delaying, if you keep on controlling your urination because there is no washroom and you want to control it, the tendency is your bladder to be distended. And once it reaches the full capacity, it will leak. We call it as overflow urinary incontinence. The other one is the most common type of incontinence. We call it as functional urinary incontinence. Inability to reach toilet to avoid loss of urine. You feel the urge to urinate and you run and walk very fast to reach the washroom. But before you reach the washroom, you are at the door, you experience urine leakage. We call it as functional. You are not able to reach the toilet to avoid loss of urine. Again, these are the different types of urinary incontinence that you have to remember. Any questions with this incontinence before I move on to the next topic? Any question? Stress incontinence. One classic example is when you cough, when you sneeze, and the pressure in the abdomen increases, and you experience urine leakage. In the exam question, I might develop one question similar to this. I might say, the patient experiences urinary incontinence every time before the lunch hour. This type of urinary incontinence is referred to as, you know already that the answer is reflex. Or I might ask questions like, okay, which of the following is the cause of stress urinary incontinence? A, sneezing or coughing. B, distension of the bladder. You know already that stress urinary incontinence is caused by intra-abdominal pressures caused by either coughing or sneezing, and that is the correct answer. Now, these are the different nursing management or nursing implementation that we're going to perform if your patient has urinary problem. First, as much as possible, we want to maintain normal urinary elimination. Number two, this is very important. You want to prevent urinary infection. Number three, in case the patient has incontinence, what do you do? Or how do you manage it? Number four, if the patient doesn't have control with the bladder at all. In most cases, we perform urinary catheterization. And number five, if the patient has surgery of the bladder or of the urinary system, urinary irrigations is performed. Now, first is maintaining normal urinary elimination. I know you are very much aware of these measures. These are actually measures that can help a patient or a person maintain normal urinary elimination. Number one, fluid intake. Very common. This is applicable even for normal individuals. As much as possible, we should consume 1,500 ml of fluid in a day. Why? Why? Because that is, remember, the urine output is expected also to be 1,500 a day. And this fluid intake is especially important if the patient has the risk of development of calculi. Calculi is a stone, kidney stone, formation of stone in the kidneys. If the patient has that risk of stone kidneys, the more you have to increase fluid intake. And fluid intake is also important, especially in hot weather, especially during summer. Okay, the more you have to increase the fluid intake, even greater than 1,500. Now, how do you maintain normal urinary elimination? Number 2, maintaining normal voiding habits. What do you mean by that? When you void, when you urinate, your position should be what? Normal. For ladies, usually urination, you should be sitting. Okay? In males, in male or men or boys, they also have their position when they urinate. And you should be relaxed. You should be relaxed. You should not be stressed so that you can have a normal urination. And of course, timing is very important. Once you sense the urgency of urination, you don't delay it. Right away, if you sense that your bladder is full, you have to go to the washroom, you have to run to the washroom, and you need to urinate. And number 3, this is particularly important, especially among patients who are weak.
ها؟
Yes. Question?
هذا الحلال نزل
الغلافة ما تسكر ابوي
بدي اروح نزل انا اجيب الغلافه تو نزل
I think your audio is open. Who is that?
ما عندي اشتراك ما عندي
Kindly close your audio.
لا غلط موجود
Could someone tell your classmate to close the audio? Hello. Can you tell your classmate to close the audio? Okay, let's continue. Please make sure that your audio is closed unless you want to talk. Just inform me if you want to share something, or else we don't want to disturb other students who are listening to our discussion. Okay, now, one of the most common problem is urinary tract infection. The bladder has microorganisms, and the patients might develop urinary tract infection. And this is specifically common among women. Women are highly prone to urinary tract infection than men. Why? Because the urethra of women is shorter than the urethra of male. Mister, why women are at risk of UTI with regards to the length of your urethra? If the urethra is short, microorganisms can easily access the bladder, causing urinary tract infection. Because the urethra of the male or men are longer, okay, it is very difficult for the microorganisms to reach the bladder. That explains why women has the higher rates of urinary tract infection. Now, if a patient has UTI, we call it as UTI. If the patient has an infection of the urinary tract, as the nurse, what we can do? Technically, if the patient has urinary tract infection, that means there are bacteria, there are microorganisms present in the urinary system. So our number 1 management is drink 8 glasses of water per day. Because the more you increase your fluid intake, the more you will urinate, the more the bacteria will be flushed out from your urinary system. Give your patients a lot of water to drink. Number 2, practice frequent voiding every 2 to 4 hours. Okay, this is very important. I want you to go to the washroom every 2 to 4 hours. This will actually increase flushing of microorganisms out of your body. Okay, number 3, avoid use of harsh soap, bubble bath powder or sprays. Maybe when you have your shower, try to avoid highly toxic soap. Bubble bath, if you have, what's this? If you have a bubble bath at home. And normally, especially for rich people, they have bathtub in their toilet and they want to spend their day in the bathtub. Again, there's a higher risk that microorganisms might access the bladder. Okay. Number 4, avoid tight-fitting pants or clothing, especially among female, especially among boys who wants to wear fit pants. Again, this can also contribute to urinary tract infection. Number 5, wear cotton rather than nylon. It refers to the materials of your garments. And number 6, take showers rather than bath, especially bathtub. Okay, why? Because again, if you use bathtub, the microorganisms could readily access the bladder, causing urinary tract infection. Now, these are the things that you have to give instructions to your patients. You can actually apply this to yourself also. Okay? This is applicable for all types of patients, including healthy patients. Now, this is very important. The worst form of urinary problem. What if the problem is urinary incontinence or leakage of the urine? I have mentioned earlier, this is very embarrassing. You do not want to wet your pants during lecture of Mr. Day. Or do you don't want to experience leakage of urine while you are playing football? Or while you are shopping in the city center, you don't want to wet your pants or this, that. This is very embarrassing. And what are the things that we can do to manage urinary incontinence? See, urinary incontinence is often treatable. That's the good news. We can treat urinary incontinence. So what do we do? Of course, educate the client and support. And number 2, bladder training. In your exam question, you might be asked, which of the following nursing intervention or which of the following measures is effective in treating urinary incontinence? The answer should be bladder training. So what is this bladder training? What do you do? What do you instruct with your patients when you do bladder training? Normally, if the patient has urinary incontinence and the patients undergo bladder training, these are the things that we do with our patient. First is postpone voiding. Postpone voiding, you tell your patient, okay, if you sense that you want to urinate, I want you to hold. I want you to resist. I want you to control as much as possible. Remember, bowel training, you want to give back the control of urination to your patient because that's the problem. So the first is, if the patient senses, okay, that the patient wants to urinate, instruct your patients to hold back. Okay, I want you to hold, I want you to control, I want you to resist. Number 2, void according to a timetable rather than according to the urge. Once the patients feel the urge to void, again, what you can do is to what? Try to stop the patient. We have a schedule here. You should void every 2 hours. And we should follow this schedule. We should follow this timetable so that the routine will be established. That's the reason why we give timetable. Okay? Your urination should be 2 to 4 hours, every 2 to 4 hours only. You cannot void in between. We need to follow the timetable. That is how we do bladder training. What else? Gradually lengthens the interval between urination. Once your timetable is, you say, your urination is every 2 hours. You cannot void in between. As you go along with the training, you can lengthen the interval. You can say, okay, now that you can control it every 2 hours, we will improve the interval. We will say 3 hours. Now, every 3 hours, you can void. And then if the patient is able to control that, you try to lengthen it every 4 hours until such time that the patient is able to totally control the bladder. until such time that the incontinence is no longer a problem. Okay? To inhibit the urge to void, instruct the patient to practice deep, slow breathing. Mister, I want to void. Okay, relax. We have a timetable we have to follow. What I want you to do now is take a deep breath and relax. This is bladder training. And this will solve the problem on urinary incontinence. Do you have any questions with urinary tract infections and urinary incontinence? Do you have any questions with the management? Is it clear? Is it clear, the discussion? Okay. Okay. Very good. Thank you so much. Okay. Another example of management of urinary incontinence is pelvic muscle exercise. Do you know what is Kegel exercise? What head and shoulder? What's that? Okay, pelvic muscle exercise, you try to practice your pelvic muscle. How do you do that? Try to contract and control your pelvic area. When you relax and control your urination or defecation, that is how you do pelvic muscle exercise. Okay? Tighten and loosen or relax your pelvic muscle. Tighten and relax your pelvic muscle. You can feel that the muscles in the pelvic floor are relaxed and contracted. That can actually help reduce incontinence. Okay, number 3 is maintain skin integrity. This is common if your patient has incontinence, and we discussed this already in the previous discussion. If the patient has incontinence, there is a high probability that the patients might develop bed sore. So as much as possible, we always keep the patients dry. Okay. And number 4, apply external urinary drainage device. If the patient has incontinence, if the patient has no control with urination, we can put external urinary drainage. We can put catheter. I will show you later on what's the catheter. Or we can use condom catheter so the urine will not leak into the pants. The urine will not leak into the bed. Instead, it will go directly into the urinary drainage system. I'm going to show you in the next few slides. Okay, this is the urinary catheterization. And next week, I think next week, your procedure is urinary catheterization. Okay? It is where you insert a tube into the urinary bladder. I want you to look at the second photo. There are 4 types of urinary catheter. It says tube. It is inserted into the urethra. It is inserted into the urethra so the patients can urinate. Okay? We call it as urinary catheter. And once it is inserted, the tip of the catheter is connected to the drainage. Yeah. Once the catheter is inserted, it is connected into the bladder urinary drainage system. The first photo is the drainage system. It is where the urine will be collected. And this is actually what you're going to do a week after next week, urinary catheterization in Fonda Lab. Now, you might be asked by your teacher why we need to introduce or to insert a tube or a catheter into the urinary bladder. Now, there are 6 purposes why urinary catheterization is performed. First is to relieve discomfort due to bladder distension. If the patient cannot void and the bladder is already big, what do? You insert catheter to drain the urine. Or to assess residual urine. If the patient has urinary retention, the patient's bladder cannot be emptied totally, and you need to examine the component of the residual urine, you insert catheter. If you want to obtain sterile urine specimen for urine exam, you can use this urinary catheterization also. If the patient is for surgery, you insert catheter also. If the patient has incontinence, there is a urine leakage, the patient doesn't have control, you can insert catheter also. And number 6, prevent contamination of the surgical wound. Why? The urine might contaminate the wound. And if the patient has a catheter, because it is collected in the drainage system, there's no risk that the wound will be contaminated by the urine. Again, a week after next week, this will be your topic in the lab. This is very interesting, and inshallah, in adult 1 and 2, when you go to the hospital, you can perform actual urinary catheterization with your patient. This is the last topic, inshallah, the last slide. Urinary irrigation. If the patient had surgery of the bladder, amalia, surgery of the kidneys, surgery of the urinary system, normally we perform urinary irrigation. Okay, and urinary irrigation is defined as flushing or washing with the use of a solution and with the use of urinary catheter. I'm going to show you the photo. I want you to look at the photo at the center. Maybe the patient had bladder surgery. Look at the photo. There is a catheter inserted into the bladder of the patient. Okay? Maybe the patient had amalia of the bladder. And the patient is also connected to the irrigation solution on your left side of the photo. Now, this irrigation is actually used to irrigate, to flush the bladder, the urinary system of the patient. Okay? And it is connected into the catheter drainage. Mister, why do we do urinary irrigation? Why do we need to flush or to wash the bladder of the patient? Okay, this is common if the patient had surgery of the bladder or the kidneys. Remember, if the patient had surgery, the bladder might bleed. The bladder might hemorrhage. There might be bleeding. So how do you stop the bleeding there? With the use of urinary irrigations. No, and usually, we use a cold solution in order to cause constriction, in order to prevent blood bleeding or hemorrhage of the urinary bladder. And there are 2 types of irrigation. We have the open bladder irrigation for manual, and we have the closed bladder irrigation. Now, I want you to look at the photo again. The photo at the center, the patient has a catheter inserted into the bladder, correct? And this catheter is connected to the irrigating solution. Normally, the irrigating solution, the temperature is cold because the cold temperature can stop the bleeding of the bladder. Okay. Now, the function of this irrigating solution, this solution will be instilled with the use of the catheter into the bladder, where it will wash or flush blood clots and prevents bleeding of the bladder. And this will be discarded through the use of catheter drainage bag. That is for closed bladder irrigation. How about for open bladder? In open bladder irrigation, we do not use this sodium chloride here in the form of IV. Instead, we use a syringe. We take an irrigating solution, put it in the syringe, and manually flush it here in the tube down. This is the tube. Okay? Attach the syringe in this tube in one of the port and flush it into the patient. It could be closed bladder, it could be open bladder. Now, which is more better, the closed bladder irrigation or the open bladder irrigation? Closed bladder irrigation is good. Why? Because there is a limited risk or low risk of introducing infection to the patient. If the procedure is open bladder, the nurse has to prepare the irrigating solution in the syringe. There is a tendency that the nurse might introduce microorganisms to the patient. That's why, for open bladder irrigation, the risk for infection is higher. That's why when you go to the hospital, the common irrigation method that we use is the closed bladder system. Again, what's the purpose of this one? We want to flush, we want to wash out the bladder with the use of solution in order to prevent bleeding of the bladder or the urinary system. Okay, now I will entertain questions with regards to our topic. Okay,